So we're going to be covering positive visual phenomenon. Positive is different than negative. Positive, the patient sees something. Negative, they don't see anything. So a positive visual phenomenon, the patient will say, I see something, a flashing light, a jagged line, something like that. And when patients complain about positive visual phenomenon, it's good to ask them to draw it. We'd like to know if it's one eye or two eye, that is it bilateral or unilateral? In general, if it's unilateral, it's in the eye. And if it's bilateral, it's in your brain. The most common unilateral positive visual phenomenon that we have are called entoptic phenomenon. Ent means in and optic means eye. And the most common causes of entoptic phenomenon are vitreous traction, posterior vitreous detachment, retinal detachment. So patients with retinal detachments or posterior vitreous detachments or floaters might say, I see a flashing light. So the retina cannot make a form visual image, so it either makes flashing lights or nothing. That's pretty much what it can do. So unilateral, we were thinking about entoptic phenomenon, flashing lights. If it's bilateral, we'd like to know the character of the phenomenon, and migraine is a super common bilateral, simultaneous, and often hemianopic positive visual phenomenon. The key and differentiating feature is the geometric nature of the phenomenon, which we call a fortification scotoma because it looked like an old fort would look like in the old days. And it typically starts small, gets bigger, and moves across the visual field. And that we call march and build up. There might be colors in it, and the colors might be flashing off and on, and that's what we call a scintillation scotoma. So a bilateral, geometric fortification, scintillating, colored or flashing scotoma that starts small and gets bigger, lasts about 20 minutes, and then the headache follows. That's going to be compatible with migraine. In contrast, occipital seizure usually is not this jagged line. It usually lasts seconds at a time, and it's geometric, small little circles. So small colored circles, seconds at a time, bilateral, simultaneous. That is almost always occipital in origin, and occipital seizure is what we're going to be worried about. Last seconds at a time, they might have mental status changes or generalize. So if you just knew these three main categories, entoptic phenomenon, migraine or an occipital seizure, that's most of the positive visual phenomenon that we see. And you got to differentiate it from photopsias, which is just, I see a flashing light, and that is almost always a retinal sign. So positive visual phenomenon, mostly migraine.